In this presentation, we will be discussing the role diversity plays in the healthcare field. Individuals are diverse in many ways. Who we are is shaped by how we see ourselves, how society sees us, and how we believe society views us. All of these influence our actions individually and as groups. For the most part, we strive to fit in and act in ways that are considered culturally and socially acceptable. Cultural identity allows people to group themselves with others they feel they have a common connection with and empower them to change the way society views or treats them. An example of this would be the feminist movement. The group was able to collectively stand up for women's equality in the workforce, leading to a change in the norm. Women are no longer expected to be stay-at-home moms. Another example is the LGBT movement, which fought for the right for same-sex couples to marry, and they have been successful in changing the laws in many states. Healthcare providers must recognize that every patient is unique and should be treated as such. Although it is important to follow policies and provide care that meets the standard of care and is evidence-based, it is also important to recognize the need to modify treatment plans based on the individual needs of the patient. You are treating a patient, not a diagnosis. It does no good to implement a plan of care that an individual will refuse to follow because it conflicts with their personal or cultural values. The plan should be modified to increase the likelihood of doing the most good. Social, economic, and/or environmental disadvantages are linked to health disparities related to poorer access to care and poorer quality of care. This graph illustrates the major role socioeconomic status, race, and age can play in access to quality health care. Bonilla Silva points out that although we may not perceive the dominant group as being better than the other, the inequalities continue to exist because the dominant group continues to benefit from the inequalities, preventing changes from being made. Healthcare providers treat patients with varying backgrounds. It is important to ensure that the personal beliefs and feelings of the provider do not influence the quality of care provided to the patient. Patients should never be discriminated on based on their status as a minority in any of these categories. On the contrary, the patient's values must be respected and every effort should be made to maintain their dignity. Diversity in healthcare can affect a patient's quality of care and dignity. Some patients' culture may require modest clothing or they may feel uncomfortable being cared for by a provider of the opposite sex. Some patients may practice a religion that does not allow them to receive blood products. As difficult as it may be, providers must still respect their right to refuse certain treatments. Providers should always offer evidence-based care, and when it conflicts with the patient's wishes, they should provide detailed patient education. Education should always be individualized to each patient. The use of interpreters is extremely important when providing important medical information to the patient who does not share the same primary language as the care provider, especially when it requires informed consent. The education should be age appropriate and layperson terminology should be used to ensure understanding. With the patient's approval, the support persons should be included to help the patient cope and make decisions when appropriate. Remember, the patient and family are an integral part of the healthcare team. Written educational material will help with any follow-up questions once the patient is released. The education should always be given in the patient's native language if applicable. As the diversity of the patient population in the U.S. continues to expand, it is only logical that the diversity of healthcare providers will also expand. This will take time. In the meantime, employers should always practice non discriminatory policies. They should target recruiting a diverse provider population. Educational institutions should also target diverse student populations and provide assistance to those with limited resources. Having a more diverse healthcare team will help ensure that patients are able to find a provider who is likely to share similar values, and in turn, they will be more likely to have trust in their care provider. Healthcare employees can help fight the disparities in healthcare. Change starts at the individual level. For example, education, becoming an ally, and being a good example are ways every employee can do their part to encourage fair and equal healthcare. Long-term change takes time and patience. Education of staff helps promote understanding and empathy. Education can be provided at meetings or through online learning tutorials. When there is an example of a positive or negative experience, it should be shared with the rest of staff on an anonymous basis so that all can learn from it.